list of businesses that are allowed to be operating. So just a really important thing, just underlying every industry sector that is starting to open right now that we want to be sure we all understand is a critical piece. So again, thanks for being here. All that chatting allowed a few more folks to jump in. And I'm going to turn it over to Tom Knipe, who is the Director of Economic Development for the City of Ithaca, and he is going to walk us through the new guidelines for the office industry sector, which is basically anyone who works in an office, right, Tom?
I think so, but you know, if you're not sure, then you can go to New York Forward and find the lookup tool and find out which specific phase your business is in. Thank you very much for the introduction and for co-hosting today with the DIA. I'm gonna walk through some slides that sort of lay out the guidelines. Again, this is for offices. Phase 2 includes some other sectors as well, real estate, barber and hair shops, which I'm pretty excited about with my long hair here. So you're here in the office reopening webinar. And you know, just to reiterate what Jennifer said, this is not a return to business as normal, phase 2 reopening. There are some very specific state requirements for reopening. And we're here to walk you through what the guidelines say that you need to do and how to go about that, and some best practices. We have a lot of questions that were submitted. We're going to have time for those at the end. Please submit them in the chat as well. Gary and Jennifer are going to help with the questions towards the end, but let's get started here. So we're talking about people, places, processes, communications, and your safety plan. That's kind of how we're going to structure the presentation today. So let's dive right in with people. And one of the most important things for you to be aware of is, you know, this is, again, not back to business as usual. You can have no more than 50% of your maximum occupancy in your facility, counting employees and customers, okay? You've got to post signs clarifying what the requirements are for employees, you know, face coverings, distancing, hand washing, disinfection, etc. And social distancing needs to continue to be adhered to in the workplace. And you really need to think about, you know, modifying the actual physical workplace and seating areas for employees so that, you know, behind, in front, on the sides, where people are working, they are a minimum of 6 feet distant. When that can't be kept, and in general, mask wearing is required. And, you know, those can be the cloth and disposable masks in most office environments. And again, you want to think about modifying your layout, modifying your practices so that you're not sharing workstations, or if you are, you have clear protocols for disinfecting them in between uses. More here with physical distancing and mask wearing. You really want to prevent congregation in waiting areas, and you want to restrict access actually to rooms or locations where those max densities might, you know, be at risk of being exceeded. You really want to take that seriously. Confined spaces like elevators, you want to limit to no more than one person in there at a time, unless everyone's wearing a mask. And then in that case, the maximum occupancy of that space would also be 50% of the prescribed occupancy. You know, more with modifying layouts, think about, you know, where people might line up. So in queuing areas, how are you going to make sure people know where to stand with markers on the floor, et cetera? We've seen this in some of the essential businesses. So we have examples of how that works. With people moving through the space, think about separating flows so that, you know, where somebody would normally walk in a two-direction way, can you make that one direction? Just to kind of maintain the separation in the way that the space functions. So think about your layouts and how you're going to modify those. Gatherings in enclosed spaces. I mean, essentially, we need to continue limiting those and using things like Zoom as much as possible. If you've got to meet in person, you know, make sure that they're in open, well-ventilated spaces and that you can maintain a social distance when you're meeting. You know, keep an empty chair in between chairs if you're using a conference room setup. And you know, you should give special attention to how you're dealing with restrooms in terms of occupancy, break rooms, etc. Give some careful thought to those confined areas. Some other sort of best practices to think about are staggering schedules. And, you know, you might want to just close. In fact, you may be required to close non-essential common areas and amenities like, you know, the coffee room and the water room. Consider just closing that to, you know, minimize and limit those gathering places and those places where there are a lot of touches of common things. Finally, with people, you want to reduce or limit your interpersonal contact and congregation. So again, adjusting workplace hours, continuing remote work, thinking about, you know, batching activities so that, you know, people don't need to be touching the same thing more than once. And, you know, really think about your policies. And, you know, there's a lot of great examples out there about how to promote best practices for remote working and checking in with people and making sure they're able to be productive. So with 50% occupancy, a lot of folks are going to need to continue to do that. And we can point you to some of those best practices. Finally, with movement and commerce, you want to limit non-essential travel, designate your pickup and delivery areas to limit contact related to deliveries, and just in general, limit your on-site interactions. So, you know, have people stay in their workspaces, designate separate entrances and exits where that's possible, so that you're just limiting opportunities for, you know, people bumping into each other and gathering in shared spaces. So really think through all those details. Let's move on to places, which is really about hygiene and disinfection and making sure your place of business is safe. So again, you've got to make sure that everyone's wearing face coverings whenever they're within 6 feet of another person. And it's your requirement. You're required now to provide them at no cost to employees. And also to have an extra supply on hand so that if an employee or a visitor doesn't have one and needs one, you can provide them one. We have a resource for PPE and disinfection materials, which we can provide to you. Perhaps we can provide that right here on, in the chat as a file that we've pulled together. But you really need to have those on hand. If anybody on this call doesn't know where to get them or needs one, reach out to us or the DIA or the chamber, and we can make sure to provide you with information about how to get access to PPE. They've got to be cleaned after each use, obviously not to be shared. You know, you've got to not just advise your employees, but also the visitors about wearing masks in common areas. And you are required under the guidelines to provide training so people know what's expected around mask wearing and how to do it properly. So hygiene and cleaning. You are required under these guidelines to keep a log of cleaning. You need to provide hand hygiene stations, and that can be hand washing, hand sanitizer throughout. And you need to provide appropriate cleaning supplies for shared surfaces, and really communicate an expectation to employees and visitors to use them whenever they touch a shared surface. if you can, think about installing touch-free amenities, including like touch-free hand sanitizer dispensers. More on cleaning and hygiene. You really need to do this very regularly. And as I said, keep a log. It should be daily or more frequent, at least as frequent as the shift is changing. And there also needs to be in your plan a process or a plan for cleaning and disinfecting areas that may be exposed in the event of a positive COVID case. And there are pretty clear CDC guidelines for cleaning and disinfecting after a confirmed infection, and that really should be part of your plan. Finally here, no buffets, no shared cakes at birthday parties. Really, you can't share food, and you need to provide socially distant space for eating lunch. Encourage people to bring lunch from home, eat it at their desks. We should be limiting the sharing of food and congregating during eating times. Finally, really take this seriously. You're all here, so I assume you are, which is wonderful. But you don't have to come up with the perfect plan that addresses every scenario right out of the gate. Consider phased reopening. Start small, be smart about it, test out what you think is going to work, and adjust. And really, again, think about limiting the number of employees, limiting your hours of operation, and limiting the number of customers that are going to be able to be served at any one time. And be prepared to adjust and make changes. You also should have a communications plan and reach out to your customers, your visitors, your employees about what the expectations for engaging in the workplace are. Go beyond signage and really think about reaching out via email and social media so that people are really aware of what it means to visit your place of business under phase 2 reopening. So that's what you need to be thinking about relating to communications plan. I'm trying to move quickly here so we can get to our Q&A. The third major area the state organizes the guidelines by here is processes. So this is a big deal, screening and testing. I know there's lots of questions about how do you do screening and how do you do that in a way that's comfortable. You must implement mandatory daily health screening practices for all of your employees and whenever practical, all your visitors as well. And that can absolutely be done remotely. There was a question about, can that be done via email? Absolutely. You can do that before they report to work or on site, but it needs to be every day. And it doesn't have to be a temperature check. It can be a temperature check. You can do that. But a simple questionnaire can be used. And really, you're just looking for answers to 3 questions. Have you had known close contact with a COVID-19 positive person? Have you tested positive for COVID-19? Have you experienced symptoms of COVID-19? And you should make sure you provide information, obviously, on what those symptoms are when you ask that question. And you gotta require your employees to immediately disclose if anything changes on that. It should become part of the culture as the daily check-in with the screening, and provide protection while you're doing that, if you're doing that right in your place of business. And make sure that you're paying special attention to how you're maintaining that separation and doing mask wearing, et cetera, in your place of screening, because that's the location, obviously, where you're more likely to come in contact with a COVID-19 person as you're screening. More on screening and testing here. If someone screens positive, so it's a yes to any one of those 3 questions, they cannot be allowed to enter the worksite, and you need to send them home with instructions and resources for contacting a healthcare provider, and then immediately notify the county health department and the state department of health. Now, there's one scenario in terms of those questions, right, where you might answer yes to the question of have you had close contact with someone who's been tested positive for COVID-19. You really want to encourage them to self-quarantine for the 14-day period and not enter the site. However, under the state guidelines, you may be permitted to allow them to continue to work if they have reported close contact, if you follow and adhere to some extra precautions. So it's just an extra level of scrutiny around no sharing of shared equipment and extra precautions with distancing and PPE and cleaning, etc. So let's see, you need to maintain a record of the screening, maintain a log, simple log. When you do that, make sure you're collecting contact information so that if there's a need for the Department of Health to follow up with tracing, that they can do that. And they can track folks down quickly and efficiently and inform them so that we can stop the spread. The guidelines require you to designate a safety monitor who's sort of being in charge of all of these details. And as I said, you got to maintain that log. So just let's imagine a few scenarios here just to emphasize the screening and testing requirements. Let's say someone has had a positive test or symptoms, but no test. What should you do? They can't come to work. They have to maintain a 14-day quarantine prior to returning to work. Let's say somebody has no symptoms, but they test positive. They also need to quarantine for 14 days. They can't come into work. And we talked about that scenario where someone was in close contact, but had no symptoms. They should quarantine, but if they're critical to the operation, the person can be approved to work, assuming that you follow certain stricter guidelines. And any employee who's symptomatic upon arrival or develops symptoms while at work must be sent home immediately. That's just to emphasize that. So around tracking and tracing here, we're still on processes. Again, you've got to notify local health department, Department of Health, cooperate with the health department. You know, again, think about your processes and your plan so that you know exactly how you're going to cooperate with them ahead of time. Get that contact information. You do need to maintain some confidentiality of the individual as well as you do that. Any employee that's notified by health officials that they've come in contact, they're required to tell you, required to tell the employer and to follow all the required protocols as if they've been exposed at work. So those are the high points of the guidelines. As Jennifer said at the top, you need to develop a safety plan. The state's developed a very helpful template. You don't have to use the state's template, but you can, and it's there. And it really is a very useful format for walking through all of these steps that you need to take and asking you questions about how you're gonna to adhere to the guidelines and documenting those plans. You really should keep a copy. I think you're required actually to keep copies of your plan on site at all times so that if you're inspected or have a complaint filed against you, you've got it there. People can ask to see your plan. And you want to share that plan widely. Don't just shove it under into a desk drawer or a file. Share it with folks so that everybody's on the same page and understands what your plan is. And then finally, you've got to attest. The state is reporting the lists of businesses that have attested to the regional control rooms. I don't think there's really a desire to do active policing or be punitive around this. There's an assumption that folks, if we get the word out about what's required, that folks will adhere to that. But thank you for taking it seriously. You really do need to complete the plan and attest that you will follow the guidelines in order to open under phase 2. So just in summary here, we've talked about some of the requirements at a very high level around people. You need to think about distancing, face coverings, barriers, signage, limiting interactions, limiting sharing of stuff, and again, max 50% occupancy. For your place of business, think about hygiene, hand washing, cleaning, disinfection, and you've got to provide masks for your employees. They can bring their own, but you have to provide them as well. And then finally, processes. Make sure you're doing your daily screening, and you understand your responsibilities for reporting and supporting health officials with the tracing and tracking. And then do your plan and attest. And with that, I think we have a lot of good questions that folks have asked prior to the webinar today, which are listed here. And I believe Jennifer and Gary are prepared to answer those questions. I may be able to answer some of them as well. We have another set of questions that have been coming in via the group chat. So I'm not sure whether Gary or Jennifer are going to sort of direct the Q&A portion of today's webinar, but we're at 3:30, which means we have a solid half an hour for some Q&A. So hopefully we can have some good dialogue and get your questions answered, and provide links to any resources you need, etc. So I really appreciate everybody tuning in, and I'll let Gary or Jennifer take it away now with our Q&A.
Thanks so much for that, Tom. We did do our best to try to keep up with additional questions coming in through the chat. So I think we managed to get a lot of those answered sort of in real time. I am going to put a link in here. I wanted to be sure everyone was aware of the executive order from the governor last week. I'm sure most people probably saw this, and it does pertain, I think, more to, you might think of it as pertaining more to a retail operation, but I think, service-oriented businesses, there's plenty of office environments where you may have people visiting your office once you begin operations again, and who may or may not be, complying on their own accord with the face mask requirements. And so just want to make sure everyone is aware that the governor did issue an executive order providing support to businesses who need to choose to ask someone to leave the premises or to deny service to any customers because they are not complying with the guidelines around wearing face masks. And again, it's not a mask on all the time anywhere. It is a mask if you cannot comply with the 6-foot distance. And as you know, most of us have a lot of spaces where it would be really difficult for someone to maintain distance every time they're moving within our spaces and stay far enough apart from everyone else if they didn't have a mask. So some people may be choosing to purchase additional PPE to have on hand for customers who walk in and may not be prepared. You're each going to have to decide how you want to manage that, but I did want to address that just because it was related to a question that we got as well, just around, how should a business handle it if a small group of people or some minority of customers that come in choose to exercise their right not to wear a mask. And certainly you may encounter that. It's not going to be comfortable if you have to ask those folks to leave your place of business. I know that you are going to be wanting and needing all the customers that that you can get right now, and so I know that may be. I think one of the other things that's really important, if you have frontline staff that are going to be put in those situations regularly, that they be given some training and some language around what can they say and how would you like them to say it, to both make sure that that the interaction is calm and respectful, and also aligns with your business values, or your organization's values. So that was one question we had gotten in, that I just wanted to address right away. Certainly some questions around limiting the number of people and how to manage your traffic flow. And Gary, I think maybe that you were going to address some of those questions.
Yeah, well, shall we start at the top? I mean, the first two questions deal with health screening. Can you health screen via email? I mean, that's really a question about understanding why the state wants you to do health screenings just in general. The goal is to keep people from coming into your operation who could be contagious. And so, you know, we have heard, I mean, certainly we've heard discussions about how, yes, you probably could do them by email, you can do them by telephone. You can, I mean, there are people who are doing them before folks leave their houses or their apartments. So I think the key there is what you don't want to do is get people to come into your office, get set up, take your coat off, put your lunch away, sit down, and then say, all right, let's do these screening questions. By that time, you've pretty much infected half the office if you have someone who's contagious. So the idea of doing it by email is good. Documenting daily screenings. Tom mentioned the fact about having a log. I know we're going to have such a log at our office at the DIA, and I think, you know, there's no real guidance on what the best way to do that is, other than you are required to ask people, and they're supposed to be, you know, you're supposed to get positive, you know, answers from all of your staff before they come in on a daily basis. If they're going in and out, I suspect you don't have to ask them every 10 minutes, but you have to ask them at least once a day. Jennifer, the next question talks about shared buildings. Many of us who have offices work in multi-tenanted buildings. You want to talk a little bit about that?
Sure. We've gotten some of those questions as well, and I did take a quick look. I haven't been able to read them comprehensively, so I will apologize. One thing I think is important to know is that these guidelines are probably like 85% the same from industry to industry, and then there's just a couple of nuances here and there to actually address the differences in terms of responsibility areas and what you need to be doing. So you know, if you're curious about what the differences are, or certainly I've seen many people curious about what a commercial property owner's obligations are, and if they're a tenant in a building with many other businesses, wondering, you know, who's in charge of what, or what the landlord's obligations are. So a couple of things that I noticed when I skimmed through the commercial property owners is that there are additional requirements around elevators, restrooms, you know, some of those points of egress and some of those hallways. They very much mirror what you see in the guidelines if you were the only owner of the whole building. But the 50% guidance of total occupancy is not just a per business guidance, it would apply to the entire facility. So for instance, if you for some reason thought that some people in your building weren't complying with that guideline, you may want to address that with your landlord, or if that was a concern area for you, you might want to ask some questions about that. Tom did touch on this already, the elevator requirement that only one person can be in the elevator if they're not wearing a mask. And if they are wearing masks or face coverings, it's 50% of the normal elevator occupancy requirement. So similar to what we heard earlier. And also that landlords may wish to open more stairwells or to provide more stairwell access, or also use signage, more signage, prominent signage about how they might want people to move around the building differently if they do want to steer people differently through the building. several of these multi-tenant commercial facilities that I'm aware of in town also have hallways and relatively narrow hallways. So again, that's a space where face coverings must be worn. You would want to reduce the total number of people traveling through the hallways at the same time. Some people may or may not be able to facilitate one-way hallway walking. I can think of a few spaces in town where you could say this hallway is only this direction. If you want to go in the other direction, you have to walk down a floor and come back the other way. You know, there's some creative things like that that somebody could probably consider. There are some notes around increasing ventilation prior to reoccupying a space if it has been completely shut down. And I'm not sure whether this applies to any of your spaces, but if for some reason your entire building with multiple business tenants and it was shut down for a long period of time, then there are recommendations about what the commercial property owner should be doing prior to actually restarting that facility in terms of checking the HVAC systems, checking some of the air filters, things along those lines. And then there were several notes around signage, all the things we're all familiar with, face coverings, social distancing, 6 feet. There was notes also about where PPE is stored and where to properly discard of PPE. So if you think about you've got more public restrooms or more public spaces, again, just like we've all seen in parking lots where people are just ripping gloves off and throwing them on the, in the parking lot for someone else to deal with. Nobody's going to want to see that in any of your shared spaces where people are taking disposable face masks and just chucking them wherever they feel like. The commercial property owner may want to really designate where should the PPE be disposed of, where's the proper disposal location for gloves and masks or those temperature strips or whatever. And then, same thing with occupancy in terms of staff rooms and shared spaces, a lot of the same kind of guidance that you've already seen. The only other one that I also had a question about pertained to restrooms, that there may need to be more frequent cleaning, special care taken to restroom facilities if they're shared with multiple tenants. And again, as a tenant of those spaces, you may have things that might make you feel more comfortable than others if the landlord were to be addressing them. So I would just encourage you to have a dialogue. If you have different expectations about or want to understand how frequently are they planning on having the commercial cleaning service come and address some of those common spaces. I think definitely, having a conversation about it, figuring out what is their plan. Yes, is it compliant with what the state absolutely requires, but also is it going to meet your needs, because you are also as an employer trying to protect your staff and also the visitors to your location. So just open dialogue about that. And those are just the key points that I noticed when I gave a quick glance through the commercial property requirements, Gary.
Okay, thank you. Yeah, I mean, bottom line, multi-tenant buildings need to put their own plan in place. So each tenant has to do one, but multi-tenant buildings have to do their own plan and attest to it.
Next question here is about where are businesses getting their disinfecting supplies. So I just turn your attention to the chat where I posted a resource that we collectively as a group of economic development service providers pulled together. So check that out. There's a lot of different types of supplies that, meet the state's requirements for disinfection.
And most of those on that list are at least local or regional.
That's right. We did try to find local providers.
Okay.
I did want to really briefly circle back and let you all know as well, something that I was just able to start including in the chamber program last week, back to the employees reporting into you every day, and a couple of other methods for you to record that. All Mode Communications is actually offering a service where you can get a dedicated phone line and your employees are going to be able to text their status into that line every single morning before coming to work. And I'm assuming that the information will be aggregated somewhere, but you maybe want to talk with them about that. It's a setup fee and then a monthly fee, and it's a system where rather than having a dedicated person have to have that interaction with them every day or be tracking that in the emails, I mean, certainly you'd still want someone paying attention, but it's sort of a really nice solution that they've created. That's a technology-based solution where the employee can just text their daily health screen status to you, and then you can check it from there. And another alternate idea that we've talked about internally is just using a Google form. If people have to fill out the short Google form every day, you can have that data all pools into the same place. The Google will tally the results. You can extract it into an Excel file if you want to, and there's your documentation already all in one place for you. So, you know, those are just a couple of additional notes to what was said earlier.
Okay. A couple questions about janitorial services, but consider using them. I mean, should I consider using a professional janitorial service? And then there's one question about if a team member tests positive for COVID-19, are the additional costs in janitorial services covered by my business insurance? Interesting question. Either of you two want to take one of those? I could basically talk a little. I mean, the one thing you could certainly say about, I know in the plan that I put together for our office, my sense was if we ever got to the point where we have a positive test case, I'd want a professional service. I'm saying I want a professional service coming in to do that cleaning. On a daily basis, we would have our staff do cleanings. But if there's an incident, I'd just assume turn it over to professionals. What do you guys think?
I mean, quite honestly, there is a lot in the guidelines about this in terms of, you know, references to CDC cleaning guidelines, what are the best practices here, how you should handle individual workspaces versus common areas. And to me, the answer to this question comes down to how much cleaning are you willing to ask your staff to do, or are they willing to do, and how much do you trust their level of cleaning? I think it makes a lot of sense to procure and provide the supplies for your staff to clean their own offices and their own desks, etc. I think when it comes to the bathrooms and the kitchen and the common areas, for example, that it makes a whole lot of sense to procure an outside service to come in a couple of times a week. And certainly, as Gary said, there's a lot in the guidelines around what do you need to do if you actually have a positive case and if you actually have spaces within your purview where there is a confirmed case. The other thing, for example, we have visitor centers. They are not opening immediately, but you know, like in the retail guidelines, for example, there's much more guidance about cleaning surfaces in between each customer, cleaning, you know, certainly if you have shared workstations, those workstations should be being cleaned in between each employee. People shouldn't just, you know, mindlessly switch you know, a cash register without thinking about wiping it down in between. And these are all just new habits that we need to develop that aren't in place right now. But the business or organization's role is to ensure that you have the procedures in place, that you have the company contracted to come do the cleaning, and that you have the supplies on hand if you're going to ask your employees to do this, or if they need to be wiping these things themselves or visitors or customers. Or even cleaning their own spaces every day, which is pretty clearly in the guidelines. You know, those are all the things I would be thinking about.
Mm-hmm. And in terms of insurance, you're going to have to check your policies. I mean, a lot of the discussions we've heard about insurance companies covering COVID-related problems have not been positive. But I mean, I think check with your agent. Because each policy is going to be very different, I suspect. And okay. Let's see. Do I have to take temperatures? Are there alternative screening methods? No, you do not have to take. You are not required to take temperatures. That is optional. You're required to ask the screening questions. Beyond that, you can decide on your own if you think that temperature testing is important enough to do, or you know, it would add a level of safety or security to you and your staff. I know at the DIA we've purchased several scanning thermometers, and we will be actually asking our staff to self-test. that's sort of our, the philosophy that we're working with. But it will depend on, I mean, so that option of scanning or of doing temperature checks is totally up to you.
Are you able to do it on your own, or do you need help?
While we're on screening, let's see, in the chat here, Jen Demarest asked if there's just one person in the office, do we have to be screened? I don't think the state guidelines address that question specifically, but I think the spirit of the screening is, should anybody else be in that space later, you want to make sure they're protected. And so, my sense would be, yeah, you want to screen yourself and document that you've done that you've answered no to those questions before working in a space that at some point other people might want to use, and you want to make sure that you're not spreading it. So that would be my response to that question.
Suggestions about dealing with people who want to exercise their right either to shop or to come into your space without masks.
I tried to touch on that at the beginning because I apologize. That was the first question on my list. Yeah, I do think it's a good time maybe to talk about signage. There are signs available on the county website for any business who wants to print these out and put them on their front window, front door. It helps communicate what your expectations are for people that are entering your space. I know the DIA had printed some and had some available outside of its office down in Center Ithaca. It's an 11 by 17 poster. Certainly you can do something else as well, but this helps you at least set the expectation. And if a lot of folks around the community are using similar looking signage, I think it'll help all of us have the same understanding around, wearing face cover, hand hygiene. If you're not feeling well, please don't come here. Some of these things, by the time someone gets to you, obviously they're pretty obvious at that point. But so these signs could certainly help you in setting expectation. I think there's some other things going on around mask wearing and around promoting that as a behavior that we hopefully will all be adopting if we want to walk into people's places of business. Does anyone else have anything else they want to add around how to handle folks that aren't wearing masks or how to encourage those behaviors?
We are looking actually for a speaker to actually work with us on that. We know that's a problem, a question that we've heard from retailers, we've heard it from offices, we've heard it from, less so from service business because you're kind of up close and personal there. But yeah, this is one of the bigger issues, I think, because on the one hand, the state is saying, you business, you're responsible. I mean, we're throwing the onus on you to make sure that you do this. On the other hand, you don't necessarily have a whole lot of, you have the right to have somebody not come onto into your space, but it gets tricky. It gets tricky really fast. And how you want to treat your customers. And one of the things that I know I've talked about and we've chatted about with our staff is if somebody came to our office and wanted to engage us like that, we'd invite them to go, we'd step outside with them as opposed to bringing them into the office. But one of the things I think we will try to do, I think as a collective here, is to see if we can find some good advice from some really customer service and de-escalation people to help think about how we deal with this issue. Because in many respects, this almost is a de-escalation issue. Someone's pushing your limits. They know they should have a mask on, and they're pushing it because they're, and so it becomes a question of, all right, what do you do now?
I think the county's been really great about reminding folks that, to be kind about this kind of thing too, and not to make assumptions. I was in a meeting of the Collegetown Neighborhood Council last week as well, where you know, a student spoke very eloquently about the fact that, you know, we shouldn't assume that students congregating together are not part of a shared household or a social grouping that really doesn't need to wear masks. And so, you know, often there are, you know, people shopping together or families that may not be social distance and may not be wearing masks, and that may be okay. So I think personally, I think we should be careful not to make assumptions about about people and their, you know, their households and their social groups. They may be following the protocols, and we may not. We may make a different assumption as well. That could happen too.
Good point. Good point. Here's a question. Suggestions for limiting the number of shoppers in a store, or for that matter, in an office. Go back to what Tom initially said. The state is capping occupancy at 50%. So there's a couple ways of doing that. You might even post on your on your door, whether it be your office door or your business door, what you believe that occupancy is, so that you can refer to that and say, you know, we're reaching that limit. But I would say your receptionist, the staff member closest to the front door, really should be somebody who's equipped and understands what those occupancies are. And, you know, you've drilled with them the steps you would have to take and what you would say to kind of hold people up or to steer people in a different direction, or to, you know, make sure you deal with that in a proper way. So, but remember, the state guidance as of now, and I suspect over time this will change, but as of now, it's 50%.
A couple of resources to mention. Lauren Debussy reminded me, you know, that Go Ithaca, a program of the DIA and the city and other transportation partners, is happy to work with organizations to build transportation policies in support of telework and flex work. So, you know, feel free to reach out to Lauren at the Go Ithaca program. And Lauren, if you want to just put your contact information in the chat there so people have it, that would be great. And then around cleaning, one of our local organizations, Challenge Industries, has redeployed some of their folks who were working on the Cornell campus into clean teams, and they have the capacity to provide cleaning services now. So if that's of interest, you can go to Challenge Industries. They're also listed on the PPE and cleaning resource document that I shared in the chat earlier.
One of the things that I want to go back to a point that Jennifer made, and sort of stress this. The county in particular gets copies of the reports that come to the regional control rooms about who's attested and who's attested. And the county has actually begun sharing those with the economic development teams here in the community, so we can be of more help. And one of the things that became just starkly clear, first on Friday and then today, is how few businesses have actually done this yet, who are part of phase 1 or phase 2. And I think our advice is, wow, I mean, that's, make sure that you do it, and make sure you tell your peers and your compatriots, that you guys know, to do the attestation and put the plans together, because it's it's very much like it's like having a business with no insurance policy. I mean, you run a big risk, and the risk is that one of your clients, one of your customers, one of your staff, one of your employees will not, will ask to see the plan, or will make a complaint. And at that point, then you will be, while the state has really turned this responsibility over to the county, and the county doesn't want to go physically out chasing people, they will, and that it's being done on a complaint-driven basis. So I think the recommendation we can make is, please, it's not that hard to a test, and it's not that hard to put a plan together. Do it.
I wonder if there are any questions that folks have that we haven't yet answered in the last couple of minutes. They want to put those into the chat, or
Yeah, so maybe let's be a little bit clear about attestation here, because, I mean, the question just came in saying, wow, it's the first time we've already heard about it. So, there's two parts to this process. You have to put a plan together, a safety plan, and you have to actually press a button on a state website that says, yes, I agree to do all of this, and press the button. And that's attestation. So I know some people on Friday, when we did this for retailers, we got some calls, at least at our office. People were really struggling to actually find where you even do the attestation.
So Gary, I'm gonna attempt to share my screen so I can show someone where to find this in their document. Really quickly, I have an example. I have the commercial building one up right now. And I'm gonna just show everyone. Hopefully everyone can see this. Can someone confirm to me that they can see the New York State?
yeah, we can see
Yes.
it.
Now,
Okay,
now, Jennifer, even before you get to this, this is on the New York Forward.
Yep.
You type in New York Forward, but don't stop there. If you stop there, you'll end up being recruited to the state of New York and get nothing. You got to put in New York Forward reopening industries. If you put in reopening industries, it'll take you right to these set of documents, and you will look for office or retail or whatever you are, and you'll see these series of buttons. One is guidelines.
So yeah, we've put the link in the chat several times already. And also, I'm sure, just so everyone knows, the chamber has sent, every time there's a new phase, both before it and after we've started, we're sending this directly in an email to everyone on our email list. And I know the DIA and TCAD are doing the same, directing people right to the New York State phase 1 and now phase 2 websites. But you do need to go back if you're, for some reason, you haven't done phase 1 yet, and that's the phase that you are wanting to submit. You'd need to go back a page from probably the link that we put in the chat box. We put the phase 2 in the chat box a couple of times. Again, as Gary said, you can scroll right down that page, and on the left-hand side, there's sort of a main menu of each industry sector. And then if you click on that one, you'll see there's a summary document. There's a guidelines and affirmation document, and then there's a safety plan template. And those big blue buttons are in there for each industry sector. And so on my screen right now is just the example for the commercial. These all look very similar. They range between 10 and 13 pages long. There's a big introduction section here, but you see this part right here. When you've read the document, you can affirm at the bottom. So you scroll through, and in here is all the nitty gritty of all the wonderful things that were in Tom's PowerPoint and that we shared with the retail in prior sessions. You keep scrolling through each of these different main categories that we've been talking about, and you get all the way to the end of the document eventually. And it's sort of really not very obvious. At the link below, affirm that you have read and understand your obligation to operate in accordance with this guidance. So you click this. And now what you'll see when you get here, this is a blank or a blanket affirmation form. This is what will show up if you're in any of those main documents. You click here for your industry sector. So if you're not in this list, and you're not seeing something that looks obvious to you as your industry sector, you'd probably want to go back to that New York lookup tool and try to see whether you're actually allowed to be open or not right now. Tom or Gary or Allison, if we haven't already put the lookup tool link into the chat box, it might be good to do that now. You want to find your NAICS code and type that right into the lookup tool and have it tell you if you're allowed to be open or not, because it's pretty hard to mess around in their different 4 different drop-down menus of industry sectors to figure it out. But so you'd go through here, you'd click, you know, I'm a hair salon. I'm going to enter my business name, my name, phone number, address, all that information, submit, and keep going through this and make sure you can actually do all the things that you're agreeing to do and that you're ready to go before you submit the form. But once you get through all those steps and you click submit on this, then you should be okay. You should get a confirmation. I would certainly print it and or take a picture of it. I don't know if it automatically emails you a confirmation or not. I apologize.
It does not.
Okay.
At least it didn't when I did it.
Of course it doesn't. So go through all of that and submit it. And again, it is kind of a hidden link in the end of your guidelines. And I think in part that's because they want you to read through the entire set of guidelines for your industry. But it, you know, obviously not being able to find it that quickly doesn't help folks. And again, I put this in the chat box earlier, but we will have the ability to confirm for you or look up if you're on the list. So if you think you already did this, but you're not sure and you're afraid to open without getting that confirmed, just send Gary or I or Allison or Tom an email and we will look it up for you and find out. Not to be a broken record, but there's under 150 names in that list right now. So, you know, we certainly want to see more folks submitting. I will say one thing that we only just last week got any clarity on is essential businesses that were allowed to operate as essential businesses prior to last week, unless they were clearly in one of the industry sectors that came forward in phase 1 and understood that now that that industry sector is clearly in phase 1, you should go on and read those guidelines and submit them for your phase 1, even if you're an essential business. There still are a lot of folks who all along have been allowed to operate or they were told they were essential, but there is not clarity about what their guidelines are supposed to be. And that's something that we just from an advocacy perspective have continued to complain and share with folks who will listen, that like we need clarity for everyone. We need essential businesses to know what guidelines you want them to follow. The retail phase 2 guidelines say essential and in-store retail. And if you look at them, there's an expanded paragraph of business types that fall under that umbrella. And I would just recommend, if this is a question for you or anyone that you know, that maybe they'd want to look at that essential and expanded retail guidelines document to see whether they fit under that umbrella and can submit those guidelines and follow them. Because we want, again, all those businesses that are still operating, it certainly is in all of our interests that everyone is operating with the same understanding, and that you know, larger essential businesses that have been running all along are operating under the same playbook as a small retailer downtown on the Commons. So that's just something I think, again, it sort of just trickled out on Friday. It's not, there's not widespread understanding that that's there yet, or that people should be reading through those and adjusting their operations accordingly and submitting those guidelines. So
there was a question raised about who should do the attestation. I mean, as you can see, I mean, and frankly, anybody can press the button. I mean, the reality is, you know, someone's agreeing to this. And so, you know, I would think at your leadership level, I mean, if you're going to designate this to someone, go ahead, but make sure people, you know what you're getting into. Because if there ever is a complaint, or if the Department of Health does stop by, I mean, you know, the excuse, so I didn't I didn't press the button. It's not going to cut mustard.
Yeah,
So,
this,
yeah,
this has already been said, but we, as Jennifer said earlier, you know, when we saw the phase 2 guidelines come out, 85% of them were the same as the phase 1 guidelines. And so if and when there is additional guidance that comes out for essential businesses, which we hope there will be, it seems likely that many of the same processes and protocols, et cetera, would apply to those essential businesses, probably with the exception of the occupancy restrictions. The essential businesses under the initial, I can't remember the number of the executive order, but the one dealing with the essential businesses, you know, specifically we're not subject to the 0% occupancy restrictions that some non-essential businesses were subject to. And so, you know, I think we need further guidance, but it would seem wise to pay attention if you're an essential business to the guidelines that are coming out and assume that you should be following them for your industry sector where appropriate.
So there is a question, and this has come up a few times, of there's still, and I did make brief mention of this, but there are still some businesses that, you know, were originally told either through directive on the state website or through additional questions to Empire State Development, or some people who also made the case, hey, we're an essential business, we should be allowed to keep operating, and the state said, okay, go ahead. There are still some folks that are falling through the cracks in terms of they were deemed essential early on, and there is not still a clear industry sector match for them in the phase 1 or the phase 2 guidance. You know, a few folks I've said, you know, get as close as you possibly can. You know, a lot of people have office operations as well as other operations out of their building. So one thing they could do is look at the office operations and guidelines and assume that they should at least be adhering to those for their in-house business activities. But we can try to help run some additional questions along those lines up to Empire State Development and try to get answers. You know, one thing I have suggested to the state and also to people from Tompkins County that's in the regional control room is just, even if the state would at least say, here's the bare minimum that we expect from everyone, because we're starting to see a lot of themes here. Again, the largest percentage of these guidelines are the same from industry to industry. Here's the bare minimum baseline that everyone should be following. And if you're already open and essential, you should at least submit this. Or at least follow this. Something along those lines I think would be very helpful to clear up some confusion for people, because I know there are some folks out there that are just sort of caught in the middle and they just don't know what to do, and they want to comply, they want to make sure they're following the right guidelines, but there's really no clear place that they should submit their affirmation to the state. So certainly I know we will all communicate if and when we get clarity on that. In the meantime, I definitely think glancing through all the different industry sectors, and there's additional paragraphs explaining them in some of these that might help you. It might give you an entrance into one of them, but you know, if any of them match any component of your business, I would at least try to adhere to and submit those guidelines.
Here's another question. Part of the guidance says we need to train employees on how to don, doff, and clean face coverings. Do we have any materials to help with this? Do we have?
The county does.
The county does?
The county does, on the county public health website.
Okay.
I saw some educational materials about donning and doffing your face mask.
I just love the word doff. I don't think I'd ever used it.
I didn't know that was a thing.
Before. So let's find that link and post it for.
Yep.
Thanks for that question, Barb.
okay. Anything else?
Oh, here it is.
I think Allison beat you to it.
Oh, goodness. Way to go.
Well,
Here's another iteration.
good luck putting your plans together. I mean, the first thing that obviously is to get to the guidelines, read the guidelines. Um, um, I know one of the things that I did when I've put two of these plans together now. And in both cases, I sort of made I made some notes ahead of time, sort of with my staff and with others about what we wanted to sort of accomplish first and foremost. And then I took those notes and kind of laid them down next to the computer and sort of went through the guidelines. And then that allowed me to sort of compare and mix and match and plug things in. And it's a fairly straightforward process. I would definitely use the state template. It makes all the sense in the world to do that. It makes it relatively easy to do so. And then obviously you need to save a copy of that. Be sure you print out and save a copy, because you want to have it in your office. You probably want to have each of your staff to have one, or at least your senior staff, and you want to make sure that it's available upon request. So making sure you print a copy of it is really important. Because if you just kind of leave it, you may not get back to it. So you all set? Tom?
There was one more question I don't think we answered specifically, and that had to do with whether remote workers needed to be tested daily as well. Some only occasionally come to the office. Do we only question them when they come to the office, or even on days when they're not in the office? And I was just, glancing through the detailed guidelines on the New York Forward website for offices, and I mean, it really talks about screening and testing, and the purpose of that being around limiting physical contact with other people at the physical workplace. So although it doesn't address it specifically, I think the spirit of the screening is for when they're physically in the location. That much seems pretty clear from the guidelines. So I think you would be safe if you only tested employees when they were physically coming into your office, and not on days when they were, working remotely. So I just wanted to make sure we got to that question as well.
Mm-hmm. And again, I think the last thing to keep in mind as you think about reopening is that obviously the state has made it pretty clear they're expecting people to come back at 50, no more than 50%. So the idea that everyone's just going to go back to just where they were before this, the state is not even saying that that's possible. So, I mean, think about how you want to phase your way back into this process. Do you want to do some remote work? Do you want to, how do you want to rotate people in and out of the office? What do you want to have people do at home? What do you want to have people do here? Recognizing that there's going to be a time period where, we're going to be working at reduced staffing. So at least staffing in office. So that's a given. And so we have to you all have to figure out what that means for you. And that's even independent of the,
I think you're right there. I do think there's some nuances to that 50% occupancy requirement. In the state guidelines, it really says it must never exceed 50% of the maximum capacity of the space. And that, I think, that has to do with what the fire marshal says is the maximum capacity, which that number may be different than your 100% workforce.
Yeah.
So, that's a nuance to kind of keep in mind too, as you're thinking about how many people to bring back.
Yeah, if you haven't done it already, I would touch bases. If you're in a multi-tenant building, if you have a landlord who's going to be putting in a plan, first of all, you'd probably want to get a copy of their plan. And then secondly, some of these questions could be answered. That question could be answered just by talking to your landlord, who's going to have a very good, much better understanding of what the capacity of space is. So,
yeah, it may be that if you can keep that 6-foot social distance at all times with everybody in your employ, in the space, and that's 50% or less of the maximum occupancy according to what the formal max occupancy is. I mean, you might still be able to bring more than 50% of your workforce back. So,
all right, good point.
yeah, I think that's how I'm interpreting that. But
Well, that is how it does read. Yep.
This is all very true, but I think a couple other things to remember are still that, the guidance at the state level, and I think what we've been hearing is, if everyone does not have to be in the office to do their jobs, as employers, we need to maybe rethink how often we expect people to be in the office versus working remotely or working from home. And I think, I keep reminding folks of this, and I'm sure most of you that have teams have realized this, but a lot of our workforce is going to need higher levels of flexibility for quite a long time. And collaborating with them and openly communicating about people's needs and scheduling needs, and trying to get ahead of that versus waiting until problems arise. Because you've got to run your business and meet your customers' needs, but you also are going to be in position of needing to meet your workforce's needs in a way that you maybe haven't ever really had to deal with before. And so, especially given that we don't know what's happening with summer camps, we don't know what's happening with school in the fall. We're still, even though we're starting to reopen, we're still in a prolonged period of, this is not normal. We are all going to have to collaborate and work together to make this work for everyone. And there's other resources out there for you as employers from the HR perspective, and from SHRM, and we're also working on getting a more human resource and workforce focused webinar on the books here in the next few weeks. But I think, as you think about the business side of things, it's important to also think about, what your team's needs are and how you're going to sort of try to meet their needs while you're also advancing your what I know are very, very critical goals to get your businesses going and keep your organizations running too. So we certainly are doing some pretty flexible things at the chamber. If anyone ever wants to ask me how we're planning to manage that and what we're doing, because we actually we were very lucky to plan to move remote before we absolutely had to, and we're pretty well set up for remote work now. So we're luckily positioned to be flexible with folks. But if that's ever anything that I can help anyone with in terms of how we're planning to manage that, I'm happy to answer additional questions. So thanks again for everyone who came today. Thanks to Gary, Allison, and Tom, and all of our organizations that we've been collaborating with to bring you this important information. Thanks for the presentation and great questions, everyone. I did want to just reiterate, in case this is of interest to anyone, we do have another webinar this week. We're all getting pretty webinared out, I know. Specifically focusing on legal issues relevant to reopening. So some of those questions will touch on some of those employee concerns, but I do know, again, that we have a lot of businesses that are concerned about how do I handle maybe the friction between what someone thinks they want to do when they come into my space versus what I'm able and obligated to allow them to do or not do as a business owner, and as I'm trying to comply with all these new regulations as well. So we do have some folks from Cornell University partnering with us to offer that topic. Celia Begonis, who's a clinical professor at Cornell Law School. And again, some of it's really going to center around a lot of those questions that you had around employee privacy protocols, avoiding legal liability, how to manage these return to work issues, and some other sort of more tricky HR concerns. So if anyone's interested in that, that's on Thursday from noon to 1. Really briefly, for anyone who's still hanging in there, I'll just post the link to that in the chat box here. And we'll certainly keep you posted as we all pull together some more topics coming up in the near future. So
thank you.
Thanks again, everyone.
A great day. Thank you.